Right. Hello, everyone. Welcome again to the Prioritize the Pause show. It's me, Danielle Bruce Smith, and I am here with the wonderful Dr. Ndidiamaka. So, we are here today to really take a pause and talk about the importance of assessing what's going on with your physical health. We are so busy working, taking care of our family, doing all these things to make sure we're caring for all these other people, and one of the first things that gets neglected is our own physical health. So today we're really going to focus on the importance of prevention. But before we get started, I would like Dr. Didi to take a moment to just tell us a little bit about herself.
Oh, well, thank you so much for having me, Dr. Tanielle. My name is Dr. Ndidiamaka Obadan, aka also known as Dr. Didi. I'm a physician, a mom, a TEDx speaker, an educator, and I help adults at risk prevent and treat medical conditions like diabetes, high blood pressure, and chronic kidney disease in as little as a 30 to 60-minute consultation so that they can go on to live longer, healthier, and happier lives. I'm a nephrologist, a kidney doctor. So that's my specialty.
Wow, thank you so much for being here and just coming here to share your amazing wisdom. And I also was reading your bio that you work with Morehouse School of Medicine. That's where I went to medical school.
Oh, really? I didn't know that. Oh, yes, yes. I'm an adjunct professor over there. And I that's what I meant when I said I'm an educator. I like to teach and pour back into the younger generation. I like to mentor the younger ones as well, because hey, if we don't pass down the knowledge, who's going to take care of us when we grow older?
Exactly, exactly. And I know that the students
Yeah,
definitely must
we have
appreciate.
to share. Yes, yes,
Absolutely.
yes, yes.
Absolutely. I
Oh,
know they
yes. Oh, I
appreciate
love.
your wisdom.
Yes, they are amazing students over there. Every time I go there, I'm always. You know, I'm of the school of thought that you can learn from everybody. I always leave there with some knowledge as well. I mean, I'm pouring onto them my years of experience, but I'm also learning from them too. So it's definitely an enriching experience for me each time I have the opportunity to teach the medical students.
Perfect. We're going to pause for just a second. My glasses. I need to get new glasses, really. Anyway, so now let's get started to talk about prevention. What are one key things that you feel like everyone should know about their health?
That's a broad question. So everything should every one thing everyone should know about their health. It starts from, are you talking about like preventing those medical conditions that we talked about?
Yeah, so like one key medical
You know,
indicator that many people don't know, but they
right.
really should know, like blood pressure, cholesterol, or their A1C.
Yes. Well, we can talk about A1C. Well, for me, it starts from knowing your family history. If it's accessible. I mean, there's some people that are not um, privy to that information for whatever reason, if they're adopted or, if the parents did not know, did not have the knowledge to pass down the information. But if you are lucky enough, and also it depends on the cultural setting because, in some cultures, it's just a taboo for them to even share any kind of information. But if you're privy enough to have all this information, that's the first place I would want you to start from. Because when you know the things that run in your family, you're better able to do stuff to proactively prevent yourself from manifesting those same things. For example, high blood pressure. If you find out that this is something that runs in your family, it means that you have to take extra care to do the things to prevent you from just going down that line and developing high blood pressure. Another example is with kidney disease. There are a lot of kidney diseases that run in families. And sometimes you can prevent them from manifesting. For example, if the kidney disease is related to obesity, for example, you may be able to, if you put all the interventions in check to prevent your obesity from from starting up, then you may be able to delay the onset of your chronic kidney disease. Or, you'll be informed to do things to make sure you take extra special care of your kidneys. Does that
I
answer your question? You know,
absolutely. I love that answer because I honestly did not think of family history, and I should have, because family history is actually a big driver for why I made a lot of the health choices that I made, because high blood pressure runs rampant in my family. Everybody except for me almost pretty much has high blood pressure. So a lot of the choices that I made was to, look at my stress, lose the weight, exercise, make sure I'm sleeping, different things like that because of that family
yeah,
history. And then
right,
even with, I don't have children yet, but as we are planning for children and I think about how I want to raise them, in my husband's side of the family, they have a lot of diabetes. So me knowing about exercise and how I would feed them and how I nourish my body so that when they're growing in me, I'm not like feeding them sugar the whole time to ramp up different things. So without me even thinking about family
right.
history as like that number one thing to think about, it actually is a very big important indicator that you actually don't have to go to the doctor for, but it drives a lot of what's going on and it can inform a lot of your different choices, especially with your lifestyle.
Exactly. Especially with your lifestyle. If you know that you are prone to have high blood pressure in your family, then you will, like you said, do all the interventions to make sure you have healthy lifestyle, a healthy diet. You're now going to be more mindful about how much salt intake that you have, and you're going to be mindful of, the condiments that you use and how much of that, whether it's the soy sauce or, the butter, which also different ways that sodium and salt is disguised in foods. You'll be more mindful of those things, and try to err on choosing the low salt options. And for example, and you mentioned something about sleep and stress management. Yes, those are also other important things to do to prevent yourself from manifesting high blood pressure and weight, especially. Oh, and alcohol is a big one. We always kind of miss this major risk factor right there. Alcohol increases your blood pressure through multiple different pathways, and it is one of those. It's one of those habits, so to speak, that I haven't really seen a lot of campaigns against. I mean, we all know that smoking is bad, and is on the ads. They put up the smoking ads with the people who have all sorts of cancers, but I don't see a lot of anything about alcohol. And alcohol is just a big culprit as well to increase the risk for high blood pressure. And you mentioned, diabetes, the weight. Most of all these things kind of go together, right? That's where you have the metabolic syndrome. One bad habit encourages all the other bad habits, and they all bring in all these medical conditions together. So now the person is obese, and then they have diabetes, and then they have high blood pressure, and now it's messing up with all their organs. They have cardiovascular disease, heart attacks, and then all the other diseases that are associated with it, kidney disease and strokes and overall poor quality of life. This is a very expensive disease to have, and so why not even take a step back and try to prevent all these things from manifesting, because now all of a sudden the patient will tell you that they're on like 20 different medications for 20 different things, or they'll take so it's always easier. I feel like this is the reason why we should definitely really emphasize on prevention. And
Absolutely.
it starts early on, in some places, it's this is one of my pet peeves. Like, I'm just going to say that this is something I don't like. I have kids, and I was very upset one time when I found out that some of the reward for the child exhibiting a good behavior was to just give them some sugary treats and candies and, and before you know it, every single day, they're looking forward to that sugar high and they're looking forward to all the sweet things. Why don't you give them pencils or, stickers or some other crayons, erasers, or even just a good pat on the back and say, good job. You did a good job as a reward for good behavior, as opposed to giving them things that make them feel they always have to have stuff in their mouth, nibbling all day long. I feel like the earlier on that we are able to stop those habits from manifesting, the better. I think for me, I mean, I don't want to make this so personal, but in some part,
It's
I
okay.
don't
Let
want
it
to
be
think
personal. Let it be personal because I was about to give a
about.
personal story.
No, I don't want to, think about the whole conversation, but so I don't, and they may even watch this. So, but some people I know, I'm not calling any names. In my family, by the way. So when they watch this, they know who they are. Some of my family members are, they like the sweet tooth. And I just didn't grow up that way. I personally, until later on in adulthood, that's when I started trying to learn this bad habit. But earlier, and I think that saved me for a long period of time from manifesting some things. You know what I mean? So, but these are the family members of mine that I'm talking about. Always need to have sweet things going on. They just, it's now part of them, and then they get bigger, and then they have the complications from being too big, having excessive calories, and joint. I mean, you name it. You're an obesity specialist, right? So this is, and then you go and start talking about having bariatric surgery and all the complications from having the bariatric surgery. Please, I think we should really focus on prevention.
Absolutely. There's so many things I want to talk about from what you said. So many things. I think there are so many nuggets. One of the things you mentioned was about with raising children, starting early with rewarding them. I am a person who was pretty much raised on like I would drink all the soda. And of course, my mother said don't do it, but I did it. I would just drink like water. What is water? Soda, chips. Like I was more of a soda chips person than anything. And I
Yeah.
don't think I've told you this, but I lost about 100 pounds over the past several years.
Congratulations. No, you
Thank
didn't
you.
tell me. I didn't know
Yeah,
that.
yeah, that was
Oh
the
my
reason.
gosh.
Yeah.
Oh.
And honestly, it's I'll tell a quick story. When I go to the doctor, my GFR is off so GFR is how your kidneys are filtering. So kind of
Yes,
you kind of
GFR
set your pH
stands
level for that.
for, correct. It stands for the glomerular filtration rate. That's what it stands for. And it is like, like a proxy to how well your kidney is functioning. Exactly. So think about it from 0 to 100%. And so when your GFR is greater than 100, above 100, that's your kidneys are at 100%. And the lower the number is, that kind of gives us an idea of how much kidney function that you have left. So what were you saying
Exactly.
about your GFR?
So my GFR has ever since I've been kind of following it, has never been over 100. And I'm like, what the heck? I've been drinking all this water, doing all these things. But then I thought back, I was like, wait a minute, uh-oh. I was raised for probably about 20 something years on just soda. So probably all that soda I drink for the first 20 years of my life. I mean, like I just tested it, it was 89. So I feel okay, it's pretty good.
Yeah, it's good.
But
You don't want it to be above 100, by the way. I just have to throw
oh,
that out there. Yes, when it's above 100, that's another thing we call hypertension. We don't want it
okay.
to be that high because that can be a sign that there's something else also going on. So 89, I don't, it's okay.
But that's the best it's ever been, the
89
89.
is like, borderline. Like you said, it's been fluctuating, right? So we
Yeah.
don't want to go with absolute numbers. So before we got to look at the trends. And I mean, I didn't know anything about, but for me, 89 is not something, unless it's, I don't know how low it dipped and how high it came up. You know what I mean? Like I have to take a look and see what's going on, but I
Yeah,
wouldn't
don't
lose too
worry.
much sleep over 89 for you.
Yeah,
If
no,
that's where it's been hovering around, like, 89, 90.
I was at like the lowest I've ever seen was I think 76 once. And then it's been in the 80s since then. So I was like, okay, well, I guess I recovered. But
Okay.
now I keep my water right next to me. So during any pause, any break, I'm drinking my water because I'm like, these
Water is
calories gotta
best.
last.
Yes, yes. Water is the best for sure.
Absolutely. And actually, while we're here, just talking about, and while I have you here, can you talk about, because everyone is like, oh, well, you need this type of water, you need alkaline water, you need this. Do you have any preference when people with their water and their hydration?
No. Um, so what I'll say about water is, yeah, I know that there's so many different theories about if it should be alkaline water, and it depends, right? Because in some people who have advanced kidney disease, we actually give them medications to alkalinize sodium bicarbonate. So in those people, they may benefit from getting the extra alkaline from their water if it's something that their physician has discussed with them. But in general, for most people, I would say just focus on just drinking normal water that doesn't have bacteria, that doesn't have impurities
Oh, of
in
course.
it, heavy metals or, toxins. Just clean water is definitely better. And um, drink to thirst and drink enough such that you're hydrated and some without bearing in mind all the other things that you may have going on. And the reason I say that is because, there are some people who may have problems, like heart failure, for example. You can just be drinking the water because you're supposed to kind of be fluid restricted, right? So this is not like I mean, I know you're going to put this in your disclaimer. It's not like medical advice because we're just talking general terms.
Absolutely.
So it is definitely what you discuss with your physician so that they can give you the best individualized treatment for you.
Absolutely.
But
Thank you.
so to answer, yeah, and so to answer your question, no, I don't typically prescribe. But me personally, and again, every physician is different, right? But I'll evaluate the patients or the clients and see what's good for them and make prescriptions based on those or on their own parameters. Don't go crazy about it being the sparkling water or because but some people need to do that to trick themselves into drinking the water because they now have this habit of whatever it is that they're taking has to be, the soda flavor. I've seen a lot of people tell me they cannot stand water and they can, just because of how they were brought up, they have to have something frizzle in their mouth. And if that's you, then that's what you have to do to get yourself away from the sugar high, the sugar addiction. Go for it.
Absolutely. Absolutely. I love that. And I used to tell my patients the same thing. People who are going from juices to soda, if you need to add some flavor into your water or do some kind of carbonated water to just transition from the juice or soda, that's fine. Eventually,
Yeah,
your taste buds will change and you'll like just regular water. But sometimes there has to be that step in between, and using that carbonated water might be that step that a person needs, and that's totally
yeah,
fine.
yeah, that's totally fine. Some people can just do cold turkey and it's okay. You just move the needle one small step at a time.
Perfect, perfect. So this has been such a wonderful, just informative conversation. If you could leave our audience with one piece of advice or any knowledge nugget, what would you leave?
I think it's very important for you to be curious about your health. Ask questions. When you partner with your physicians or your health coach, don't be afraid to don't leave there thinking, oh my gosh, I just had this whole conversation and I didn't even know, I don't understand exactly what he just said. I mean, that's why you're there to learn about your body and make sure that they listen to you. Make sure you find somebody who listens to how you feel and what you are describing. Don't let them just, yeah, they may have all the years of education, but it's your body. So you are the authority of your own body. Ask questions to your doctor, write it down. Take a notebook and write it down. That's the one piece of advice that's very important. And so that you can study about it. And if you go and do some more research, you can get some more questions. And nowadays, I speak for myself, I'm available as a physician. I'm available through, my phones, my messages, and emails, to respond to them. May not respond to you immediately because they have.
They didn't contact me 5 minutes later. What?
It's it may not be immediately, but they will get to it. And, just keep asking. And then just, back in the day, I think it was a taboo to ask questions, where you just do exactly what the doctor tells you. And I feel like there's a big problem with that because it's a partnership. I want my doctor to listen to me when I'm talking, and I want us to come up with shared decisions, and I'm going to trust them because they're the experts in the field. They've been studying, that particular area for years, so they have the best knowledge, but it's my body. So we're going to come to a decision together. That's what I appreciate in my doctors, and that's how I want to be for my patients.
Oh, that is so good. Thank you so much, Dr. Didi. For our last
Thank
few
you.
moments, please tell me, where can people find you? Where can people connect with you?
Well, our practice is located in Kennesaw, Georgia, and we're currently accepting patients. We can be found on our website at YoungerSelfMD.com. We're on YouTube at YoungerSelfMD, and on Instagram at YoungerSelf.md. And our email is admin@YoungerSelfMD.com. So feel free to reach out to us. We're also on Facebook at YoungerSelfMD as well. Reach out to us, contact us, ask us questions, comment, like, and subscribe to our channels. Let us know what you want us to talk about. I'll be happy to make some more videos just for you.
Dr. Didi, you are phenomenal. You are amazing. You are a
Thank
blessing to
you.
everyone who gets the chance to be around you and to interact with you. Thank you so
Aw.
much for being here. We appreciate you.
And you're amazing too, Dr. Janelle. Thank you so much for having me. This was so much fun.
Yes,
Well,
thank
ask me to
you.
come back. I would love to come back.
Yay! Bye, everyone. Thank you.
Bye.